Hello everyone and welcome to my channel. Today's discussion is on the topic of bioavailability of the drug. So the bioavailability of a drug, let us first understand what the word bioavailability of a drug means. The bioavailability of a drug basically refers to the fraction of the administered dose of the drug that will ultimately reach the systemic circulation after administering it by any route. So the fraction of the administered drug, the fraction of the administered dose of the drug that will reach where? The systemic circulation after it has been administered by any route. So that is what we mean by the word bioavailability. So now let us see how can we express the bioavailability of a drug. So let us suppose that we are expressing bioavailability as the letter F, right? So F denotes bioavailability. It can be expressed as the quantity of the drug that reaches the systemic circulation, divided by the quantity of the drug administered, right? So if we have to express bioavailability, we can express it as, let us suppose that the word F is going to express bioavailability, or going to denote bioavailability rather. It can be expressed as the quantity of the drug that reaches the systemic circulation upon the quantity of the drug that has been administered. So this value of F will range between 1 and 0, 1 being the highest, right? And similarly, if we multiply it with 100, then we are going to get it in percentage. So upon multiplying this thing by 100, we are going to get it in percentage. So now let us have a look at how can we calculate this bioavailability, right? How can we calculate this bioavailability? So for calculating the bioavailability, right? Now we have to calculate bioavailability. So let us suppose that we are drawing a curve, okay? This is a curve, right? So on one of the axis, we are plotting time. And in the other axis, we are plotting the plasma concentration of the drug. So in one of the axes, we just plotted time. And in the other, we plotted the plasma concentration of the drug. In that plot, this is the kind of plot that we are going to get, right? So the area under this curve, that is this area, the area under the curve, the area under the curve will give you the bioavailability. Will give you the bioavailability. So area under the curve of a graph plotted between time and the plasma concentration of the drug will give you the bioavailability of the drug. Okay. So far we have learned about three things. The first one is the what do you mean by bioavailability? Second one is how can we express it? And the third one is how can we calculate it? So if we give the drug by IV route, that is the intravenous route, then by definition the bioavailability comes out to be 100%, right? So when the drug is given by IV route, then by definition the bioavailability of the drug comes out to be 100%. But in other cases, in other routes, it may not be 100%. The reason is there are mainly two reasons for this to happen. The first reason is the extent of drug absorption, right? So the first reason is the extent of drug absorption, and the second reason is first pass metabolism. The second reason is first pass metabolism. So whenever we are giving a drug by IV route, then by definition the bioavailability comes out to be 100%. But in case of other routes, it may not be 100%. There are basically two reasons for that. Number one is the extent of drug absorption, and number two is the first pass metabolism, right? So now let us deal with these two things. So the first point that we have to discuss is the extent of drug absorption, right? Extent of drug absorption. We are going to discuss about the extent of drug absorption. Now, let us suppose we are giving a drug by the oral route, right? So this drug will be absorbed from the GIT, right? This drug will be absorbed from the GIT and ultimately it will reach the system in circulation, right? So in case of GIT, most of the drugs will be absorbed from the intestines. Most of the drugs will be absorbed from the intestines. Now, why is it going to happen? Because the surface area of absorption, will be high. The surface area of absorption will be high. Now, why it will be high? Because, as we all know, the presence of villi. So the presence of these villi or villi is going to increase the surface area of absorption, and most of the drugs preferably will be absorbed from the intestine in case of oral administration, right? So suppose we are giving a drug orally. Let us suppose this is the lumen of the GIT, right? This is the lumen of the GIT, and let us suppose this is the systemic circulation. So for a drug to be absorbed, it has to cross from this lumen and go to the systemic circulation for it to have a higher bioavailability. So if there is incomplete absorption, then obviously it means that there will be lesser amount of drug that will go to the systemic circulation, and hence there will be decrease in the bioavailability, right? So if there is incomplete absorption of this drug, then obviously lesser amount of drug is going to go into the systemic circulation, and there will be decrease in bioavailability, right? Let us suppose that if the drug that we are giving, if it is too hydrophilic, that is, if it is too hydrophilic, then obviously that drug cannot cross the lipid bilayer of the cell membrane, right? So if a drug is too hydrophilic, then it cannot cross the lipid bilayer of the cell membrane, right? And if the drug is too lipophilic, then it won't be able to cross the water adjacent to the, it won't be able to cross the water that is adjacent to the cells. So if the drug is too hydrophilic, then it cannot cross the lipid bilayer. If the drug is too lipophilic, then it cannot cross the water that is adjacent to the cells. So the too hydrophilic drug is atenolol. This is a beta blocker. And the too lipophilic drug is acyclovir. Right? This is an antiviral drug. So in both the cases, the absorption will be low. So we can say that the absorption of the drug, the extent of absorption, it is directly proportional. It is directly proportional to bioavailability, right? It is directly proportional to bioavailability. That means more the absorption, more is the bioavailability. More the absorption, more is the bioavailability. Right? Let us come to the second point. The second point that we are going to discuss is the first pass metabolism. So the second point is the first pass metabolism. First pass metabolism. Now, there will be a detailed video on first pass metabolism. So we are just going to have a nutshell view on this topic. So again, let us come to a scenario where we have given an oral drug, right? Oral drug. As I've already said, that drug will preferably be absorbed from the intestine and will ultimately reach the systemic circulation, right? But when that drug reaches the intestine, when the oral drug that we are giving, once it reaches the intestine, then from the portal circulation, it will go to the liver. So the oral drug, after crossing the intestinal epithelium from the portal circulation, will ultimately reach the liver, right? So once that drug reaches the liver, there can be two possibilities. Once the drug reaches the liver, there can be two possibilities, right? Let us see what they are. So now that our drug has reached the liver, there can be metabolism of the drug. Right? Metabolism of the drug. And it can be excreted in bile. So once the drug reaches the liver, there can be metabolism of the drug and it can be excreted in bile, right? So then from there the remaining portion will reach the systemic circulation. So suppose 100 mg of drug has reached the liver, right? And 25 mg we have lost due to metabolism and excretion in bile. So how much is ultimately reaching the systemic circulation? 75 mg, right? That means due to the first pass metabolism, this phenomenon when the drug undergoes a metabolism before it reaches the systemic circulation. That is, metabolism of the drug before reaching the systemic circulation, is known as the first pass metabolism. First pass metabolism. Some books also refer to it as the first pass effect. Right? So the metabolism of the drug before reaching the systemic circulation. And where is this metabolism mainly occurring? Where is this metabolism mainly occurring? The site is in the liver. So that is where the metabolism is mainly occurring, right? This is known as the first pass metabolism or the first pass effect, right? So now, due to the first pass metabolism or the first pass effect, the amount of drug that reaches the systemic circulation will be low. That is, due to the first pass metabolism, the drug that ultimately reaches the systemic circulation will be decreased. So we can say that bioavailability is inversely proportional to first pass metabolism. Bioavailability of drug will be inversely proportional to first pass metabolism. That is more the first pass metabolism, lesser will be the bioavailability. So, to sum it up, the bioavailability of a drug is directly proportional to the extent of absorption, and inversely proportional to first pass metabolism. These are two of the key points that we need to remember, right? So far what we have learned about bioavailability, the first point is that it is a fraction. Fraction of the administered drug that will reach the systemic circulation. That is point number one. Second thing what we have learned is that we can represent it in the form of the quantity of the drug that will reach the systemic circulation, upon the total quantity of the drug administered. So the value of bioavailability will vary from 1 to, that is between 0 to 1. 1 being the highest. Right? The third thing that we have learned is that the bioavailability can be calculated. From the area under the curve. the area under the curve of a graph that is plotted between the plasma concentration of the drug, and time. So the area under the curve plotted between plasma concentration of the drug and the time will give you the bioavailability of the drug. The next thing that we have learned is bioavailability when a drug is given by IV route. It is by definition 100%. By definition it is 100%. But for other routes, it may not be 100%. And why is that? Because of two main reasons. Number one is the extent of absorption. And number two is the first pass metabolism. So first pass metabolism. And how are the two related to each other? Bioavailability is directly proportional to first pass metabolism, right? But it is inversely proportional. Bioavailability is inversely proportional to first pass metabolism, right? So now let us see what is the significance of bioavailability according to the various routes of drug administration, right? We will now see the bioavailability according to the various routes of drug administration. Okay. So if we go through this table, then we can see, as I've already told you, that for the intravenous route, the bioavailability is 100%. Right? So what is the characteristic of that? The characteristic is that there will be a quick onset of drug action, right? Almost immediate effect. And that is why this route is preferred in case of emergency. We prefer the intravenous route in case of emergency. However, there is an increased chances of adverse effect, right? So from intravenous route, the bioavailability is 100%. So as a result of that, there is a quick onset of the drug action, obviously, almost immediate effect, preferred in emergency, but there is an increased chances of adverse effect. The second route is the intramuscular route. So the intramuscular route, the bioavailability varies from 75 to 100%. For the intramuscular route, the bioavailability varies from 75 to less than or equal to 100%. The larger volumes of drugs may be given, right? But as we all know, these injections can be painful. That is, intramuscular injections can be painful. Now moving on to the subcutaneous route, again the bioavailability will be from 75 to less than equal to 100%, same as the intramuscular route. But the volumes are small. That is, smaller volumes than intramuscular route. And these injections can also be painful. Right? So now moving on to the next route. The next route is perhaps one of the most common routes, and that is the oral route. However, the bioavailability varies from 5 to less than 100% for oral route. But the advantages or the characteristic is that this is the most convenient and safe route, right? As we all know, the most convenient and the safe route of drug administration. However, it requires patient compliance. That is, the patient must be in a position or in a state to take this drug by themselves. And the next is that the first pass effect. The first pass effect, as we have already discussed, the first pass effect may be very important for its bioavailability. The first pass effect may be very important for its bioavailability. That is, ultimately, it can lead to erratic bioavailabilities. The bioavailability of the drug may be erratic due to the first pass metabolism, right? Next is the per rectal route. So the bioavailability varies from 30 to less than 100%. However, the first pass effect of per rectal route is less than that of oral route, right? So oral route, as we've already said, it has a high first pass metabolism chances, which may ultimately lead to erratic bioavailability. But for the per rectal route, there is a less chance of first pass metabolism. The next route is the inhalational route. The inhalational route, the bioavailability varies from 5 to less than 100%, but there is a often rapid onset of action. Now in the upcoming lectures, we are going to see how this is happening. So for inhalational route, bioavailability may vary from 5 to less than 100%, but there is often a rapid onset of action. Another route that we have is the transdermal route. Transdermal route. Now, this transdermal route has a bioavailability that ranges from 80 to 100%, right? The bioavailability ranges from 80 to less than equal to 100%. So the first characteristic is that there is a slow absorption of the drug, right? There is a slow absorption of the drug. Because of this slow absorption, there is prolonged duration of action. There is prolonged duration of action, right? And there is no first pass metabolism. There is no first pass metabolism, right? So that was the video, guys, and I've tried to discuss bioavailability in the most important points. So we will continue our lectures in the upcoming videos, and until next time, thank you and have a nice day.